Hello, Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning, and I'm talking today with Tammy Ruiz Ziegler about her upcoming presentation titled Perinatal Palliative Care. Welcome, Tammy.
Thank you so much. I'm so happy to be here.
I'm so glad that you were able to spend a minute here talking with me about this topic. Um, why don't you introduce yourself a little to our audience here, to our listeners, and tell us a little bit about your professional journey and how you got interested in the topic?
I have been a nurse for many years, and I have focused most of my career in maternal child health, specifically in neonatal intensive care. I always appreciated all the different facets of the NICU, but I found that I really gravitated towards working specifically with families in crisis, and I was really challenged by the difficulties that families who are experiencing death in the neonatal ICU, how their experience really affected their families, and how the really positive influence of a well-prepared nurse could positively influence the experience that families had of an end-of-life experience in the NICU. And so throughout my career, I really gravitated towards those situations. And when I applied for a job as a perinatal bereavement coordinator, I presented my new leadership with my vision for the future, which was to start a perinatal palliative care program that involved our entire care center, our neonatal intensive care unit, and the patients that we take care of on labor and delivery.
That's a wonderful journey, and thank you for sharing this. About the topic itself, perinatal palliative care, or in some of the literature calls it perinatal hospice care, is a topic that many care providers in the field don't really know about. Many midwives or doulas, and nurses, they care for women in pregnancy, and always the outcome, is supposed to be happy mommy, happy, healthy baby. And when now confronted with a life-limiting diagnosis for the baby, many care providers feel ill-equipped and completely helpless how to support their clients, their families. What are your thoughts on that?
There are really three main sets of cohorts of patients that might fall into this category. One of them is babies born alive that are so premature that the care that's offered in neonatal intensive care units really is not even prepared for babies this premature. I'm thinking of the babies that are born at 19, 20, 21 weeks gestation, where the care, there really isn't a lot of care options, even in the NICU for these babies. And so generally they are born in a process of dying when those babies are born in our care settings. Then we have another group, which is the babies that might be in the NICU and might be doing okay for a while, but at some point in time, the acuity of their illness becomes so severe that even the most aggressive therapies in the NICU no longer are effective for them, and the care team starts to look at transitioning to a palliative care plan. And the third group of infants that I work with in this cohort are infants where a prenatal diagnosis is made during the mom's pregnancy, very often somewhat surrounding about the 20-week anatomical ultrasound that is done in our country. It's very common for women to get an ultrasound at 20 weeks gestation. And very often at that point, as well as during the time when they're getting any genetic screenings back, that's when the diagnoses of things like anencephaly, where the baby has no brain, or holoprosencephaly, which can be a sometimes fatal severe brain disease, or something like renal agenesis, where there are no kidneys, and then subsequent pulmonary hypoplasia. Some of these diseases that are relatively rare, but they do occur, and the women who are pregnant halfway through the pregnancies with these babies have to figure out what they're going to do and how their family is going to cope with this difficulty. So for each of these three different groups, the family and the staff are looking at how to figure out how to best care for these babies in an end-of-life situation.
Mhm. You made a very important point there, discovery during pregnancy, and that led me to another question right here is, should we as care providers do a better job of educating our clients that, I mean, we're always expecting, once we get pregnant, oh, just, go have a happy, healthy baby, but that things can be different. Do you think we should start earlier in, like in childbirth education classes or such to maybe, and nobody wants to deal with, a sad topic, but
It's true. I wish that we handled the whole topic of perinatal death in our culture kind of the way we handle breast cancer, because in our culture, the whole topic of breast cancer is so widely discussed, and people see it in the media, and it's discussed so widely that even people who are not in the medical field could probably explain to you a number of things about breast cancer because they hear about it so much. And yet, almost about 1 in every 5 pregnancies will end very early on, and even for women who make it to the middle of pregnancy, from 20 weeks gestation to the first 28 days of life, 1% of babies will die, which 1% doesn't sound like too much, except when you realize that with the number of women that are pregnant in like even in just our country in a given year, 1% loss is actually a significant number of babies. And so I don't think we are doing the women in our culture any favors by not discussing it. I think it should be discussed in sex education in high schools. I think people should, the topic should be one of the culturally understood things it's helpful for people to know that it happens. I once read something about the topic of perinatal death with regard to birth education. And this author whose article I was reading said, people come to us to be educated about something they do not know. And if we do not tell them the truth and let them really understand the topic, then we have not properly done our job. So on some level, I do think that it's important for maternal child health educators to let parents know that to a certain degree, perinatal death is a possibility.
well, thank you very much, Tammy, for talking with me today. I am very interested in this presentation, your presentation that's coming up, and the presentation is part of the Trauma Care Lecture Pack. And to find out more information on this presentation and on the lecture pack, please visit www.goldperinatal.com. Thank you all for listening, and thank you so much, Tammy, for spending some time here with me. Bye bye.
Bye bye.